Hello, everyone. I'm JP Hornick, President of OPSEU CEFPO. My pronouns are they, them. I'm here with Fred Hahn, President of CUPE Ontario, and Erin Ariss, President of the Ontario Nurses Association, and Glenn Wheeler, who is the Director of COPE. OPSEU CEFPO proudly represents over 180,000 members, many of whom work in healthcare. Particular to today, many of them work within the various LHINs in home care. And we're here today because the Ford government is intervening in the delivery of home care services in a way that is going to turn out to be another expensive boondoggle. There are 14 LHINs in Ontario. All of them face funding crises on a regular basis. The solution to their crises is to fund them, not to force them into another messy round of restructuring. Instead of listening to the needs of patients, their families, and frontline healthcare workers who all have the same diagnosis, a lack of adequate resources, this government is deliberately causing chaos in the system once again. There are multiple unions in each of the LHINs. And what this government wants to do is to pit union against union, draining energy and resources from the sector in an effort to distract from the fact that Ontario is simply not funding the services that Ontarians desperately need. It's why I'm here on behalf of OPSEU CEFPO, to stand in solidarity with our fellow healthcare unions today to send a message to Doug Ford. Stop the chaos. Stop these games that are designed to obscure the lack of adequate funding for healthcare. Our system of public health care is crumbling, and this government is playing labor relations games with us instead of actually fixing the crisis. Ontario's healthcare unions will not stand for this. We are here, together, in solidarity, to tell the government that we are working on collective solutions. Instead of fighting each other, our focus is on patients and their families, on healthcare workers and the home care system in its entirety. We know that we can work together to streamline the work of the LHINs while protecting patients, frontline workers, and the communities in which we all live and work. We invite the government and the ministry to join us. The restructuring that this bill envisions will cause chaos if the government doesn't work collaboratively with all of the unions in the sector. This is not what providers are asking for. It's not what patients and clients are asking for. It's not what PSWs and nurses are asking for. It's not what workers across the system are asking for. And it is certainly not what the people of Ontario are asking for. We know the prescription for better healthcare in Ontario: better and sustainable funding and a cohesive public system. Join us, work with us, and support the workers who actually provide the care that Ontarians desperately need. Thank you very much.
Good morning, everyone. As a proud registered nurse and the provincial president of the Ontario Nurses Association, I am here in solidarity with the president of OPSEU, JP Hornick, president of CUPE, Fred Hahn, and Glenn Wheeler from COPE. We're here to alert people in this province to the fact that Bill 135 will do considerable and irreversible damage to Ontario's home care system. What it will not do, I want to be clear, is break the solidarity of our unions and the workers we represent. The forced amalgamation of 14 home and community care support services into one huge entity called Ontario Health at Home is not good medicine. It is likely to limit much-needed access in home care services to thousands of Ontarians who do not live in larger centres like where we are today in Toronto. This is just the latest disaster of a bill from this provincial government. Bill 135 will allow home care services to be diverted to more populated areas, leaving people who need help recovering in their homes, it's just so absurd, at home with even more limited access to the services they need. Right now, many Ontario residents are not receiving the home care they require because of staffing shortages. Occupational therapists, speech-language pathologists, personal support workers, physiotherapists, nurses, and so many more healthcare professionals are not where they need to be in the homes. Bill 135 does nothing to address the shortages, which are one of the most pressing issues in this sector. We need to focus on retaining and recruiting workers who coordinate and provide and make this home care possible. The government's own data notes that Ontario will need at least 6,800 more PSWs just to maintain the current level of services, and similar numbers for nurses, occupational therapists, physiotherapists, and home care sector health professionals. This is yet another healthcare tragedy for Ontarians, and it is wholly preventable. It is imperative that Premier Ford and Health Minister Jones meet with us, the unions, and together we can develop sound solutions so that all Ontarians can receive the home and community care access services and supports they need and they deserve. Thank you.
Good morning. I'm Fred Hahn. I'm president of the Canadian Union of Public Employees in Ontario, and I'm very happy to be here today with my colleagues Erin and JP and Glenn to ring alarm bells about a massive restructuring that is getting very little attention. The Ford Conservatives passed Bill 135, the Convenient Care Act, into law, forcing the 14 home and community care support service organizations into one. While this might sound on its surface like something that could potentially strengthen the system, this reorganization does nothing but bring a new level of chaos to a system that's already broken. Bill 135 perpetuates the fundamental problem in this vital part of the healthcare system. By implementing and causing massive uncertainty for home care workers and for those who rely on home care supports. The problems in Ontario's home care system run deep and they are long. They are born out of decisions of a previous last Conservative government under Mike Harris and continued by years of successive Liberal governments. That essential problem is privatization. We know the Ford Conservatives are opening private hospitals for the first time in our province's history. We know they've given away huge responsibilities in the health sector to vendors like Shoppers Drug Mart and other private sector operators. The restructuring of home care delivery is absolutely about rationalizing spending and furthering privatization, or at least that is our concern, and furthering the contracting out that already exists in ways that devastate home care delivery. Privatization and contracting out have lowered home care workers' wages. It's made the majority of this work precarious and part-time and contract. It's resulted in a real decline in the level of support that people who need home care can receive. For many years, CUPE Ontario, the Ontario Health Coalition, many experts, allies, other unions have all advocated to return to a fully public, fully integrated, and fully funded and supported system of home care delivery. But sadly, that is not what we have today in Ontario, and it is not what this legislation will bring. We are just 6 weeks away from the full implementation of transitioning 14 different agencies into one, and yet, despite many attempts to learn more about what the Conservative government's plans are for this transition, its impacts on workers, its impacts on service provision, we know nothing. The Tories have refused to be transparent about how this process will unfold, how it will affect our members, other workers in the home care system, how it will impact home care delivery for those who need home and community support services. We've heard anecdotally that some supports that are currently available will no longer be available from those receiving care, who are being told today, good thing you got it under the wire before things changed. Home and community care support services, or HCCSS workers, provide care to over 400,000 Ontarians a month. People don't care about what acronym or what structure the service has. What they want and need is care. People deserve to have supports of caring professionals who are respected and well paid, who are able to be available for them and their families and to receive the care they need in their homes and their communities. But again, it's not what we have today. We have a fragmented system with workers that are paid far too little, Many who are paid when they don't even travel, like they're traveling between homes, they're not paid. Given part-time hours, precarious work, and many have to have a second job just to make ends meet for their own families. This isn't what people deserve. It is not what those who need home care supports deserve. It is certainly not what those who deliver this important work deserve. It's also shocking to know that many other healthcare professionals have already been rectified and received money, back pay for the horrible impacts of Bill 124, but CUPE community and home and community care workers still don't have any rectification. In fact, the government's offering them a fraction of what other healthcare professionals have received as a result of the devastating impacts of Bill 124 after it was declared unconstitutional. It's a mess. But today, as I said, I'm proud to be here with my colleagues in ONA, in OPSEU, in CUPE, to say clearly and with one voice that we will not stand by as representatives of workers in this system and just let chaos unfold. We are committed to work together to ensure that this transition doesn't result in our unions having to spend hours and hours at the labor board fighting over who represents who. Instead, we are going to work together to propose a model of representation so that our unions can then spend our time and energy focused on real solutions and more funding for home and community care. An end to contracting out, permanent work for workers that is well paid, respect, the same kind of respect that other healthcare professionals receive, including the same amount of money to rectify the damage of Bill 124 that other healthcare workers have received. Today, we're standing here in solidarity. We will not allow the uncertainty that is being caused by this system or by this restructure to open the door to more privatization in home and community care. We know what we can accomplish when we work together. And we know that when we do that, we're doing it for the best interests of our members, of the workers in the system, but also in the best interests of those who rely on home care in our province. Thank you. Open for questions, Dan.
Can you give us a little bit more information about what is going on with the representation? You mentioned pitting unions against each other at the labor board. Can you just sort of spell it out? What's going on?
Well, that's difficult.
Yeah, I mean, what we're looking at is that they've given no indication of the path forward in terms of representation for the workers. What we know are there are models in other provinces that we've looked at, that we've proposed, we've suggested, but from the employers to the government to the unions, everyone's been kept in the dark about what their plan is in terms of the integration and the subsequent representation. So what we're trying to do is get ahead of it and say, listen, we've been saying this for months now. We're willing to work together to figure out how we're going to best represent workers across this province in the home care sector.
Is that because there's different representation with the different, I know they're not called LINs anymore, but the things that used to be LINs?
Yeah, so there's 5 different unions that are present in the LINs. 4 of them are here today. I think that Unifor wasn't able to join us. But the 3 largest, I think, are CUPE, OPSEU, SEFPO, and ONA. When we look at that representation, we know that there are models for us to be able to collaborate in order to continue to represent our workers across the province, to figure out how we do that well, and to negotiate, in solidarity with the government. Is there anything that you want to?
But what do you mean that they're pitting unions against each other? Give us an example.
Yeah, so the fear in this, or the worry in this, is that what they want to do is distract from the problems that are present in the home care system by suggesting that, the unions can duke it out amongst ourselves and figure out who will represent the workers at the end of the day. And they'll either do that, by mandate or directive, or, allow us to go through dozens of what are called placerta votes. What we're saying is that doesn't need to be part of this equation at all. We're all perfectly happy to continue representing the workers that we represent and to figure out how to do that at a common table in negotiating with the ministry.
You used the word chaos multiple times.
Yes.
So what does it mean for both workers and also people who use home care services?
Chaos is what is happening in this sector. They have restructured and reorganized and renamed I don't even know how many times. We had CCAC, LINS, now HCCSS, and now we're going to a different model again. And all of this has transpired in less than a decade. So what you have are workers that work under uncertain terms, and now add to that uncertain collective agreements. We know that there's a huge wage disparity within this sector between classifications of workers, but also in other sectors. They're not paid the same as hospitals, for example, or long-term care, or the home care sector proper, which is another issue entirely, which is almost entirely private now. So when you add the uncertainty of a restructure, there are thousands of vacancies in this sector in home HCCSS. You add that, you add the disparity, the disrespect, the lack of transparency, and of course, you have a demoralized work sector. You have demoralized workers that aren't performing their best right now. And I think we can all understand that. Ontarians deserve the best providers that are in a constant and fair and respectful work environment, and they're just not receiving that right now.
So, just to follow up on before, have you proposed a plan to the government to continue representing who you all represent, and have they sort of rejected it? Is that accurate?
I think what we'd like to see is be given the opportunity to meet with them, and they haven't even entertained that yet. I think that's fair. Unless, Fred, do you have something to add?
I just want to add, perhaps, in relation to all this chaos, that in the context of the way in which the Ford Conservatives are dealing with the rest of our healthcare system, opening private hospitals for the first time in our history, devolving a bunch of services to for-profit corporations, we're quite concerned that this isn't about anything to do with efficiency of operations, but is in fact about conglomerating something together to make it easier to sell, to make it easier to offer to for-profit providers who are already deeply ingrained in the home care system in a way that has been really difficult to manage for people who require home care, and has resulted in really low wages and precarious work for the people who deliver the services. There's a real concern there. They won't talk to us at all about this stuff. And what they need to understand is that we are talking with one another. We are committed to working with one another to make sure that whatever happens here, we can preserve the best of what's happening in the system. We can work together, because honestly, why would they have differential wages? Why would somebody delivering home care in Toronto make a different wage than in Durham Region, or somebody in Timmins make a different wage than in Thunder Bay, when they're doing essentially the same work? Fragmenting the system has only benefited them, and so we're saying we're done with that. We want to work together to ensure the best outcome for the people who do the work. That ultimately means we get the best outcome for the people who rely on the services they provide.
And we know that having home care in one centralized body is not the actual end goal. They've made it clear that their plans are to delegate at least some of the responsibility to the Ontario health teams. Do you have any sense at this point how that's going and what your role will be when that change happens? What means whoever we end up at that point? No. There's no information sharing. There's no real attempt to actually engage to figure out what the future could look like and should look like. And we are 6 weeks away from implementation. 6 weeks away. And so imagine the uncertainty as a worker, right? You don't know who your employer is going to be. You come to your union, you ask, what's going on? And all we can say to them is we don't know, because they won't tell us. And in the midst of all of the other things that are happening, the very many important things people are dealing with, the cost of living crisis, the housing crisis, the environmental crisis, this is an issue that people aren't talking enough about. The people who rely on home care, the people who work in the system, are absolutely worried about what the future holds.
Fred, you talked about how CUPE workers are being offered way less than others in terms of, I guess that's the Bill 124 top-ups. Where is it at right now?
We've been in negotiation with the government on this question for months. As you might know, many other workers have been rectified. This is not a top-up. This is money that was stolen out of workers' pockets by passing legislation that was deemed unconstitutional not once, but twice. This is money owed to them. And they have offered a fraction of what other healthcare workers have already received. We're simply not going to settle for that because we understand that these workers, like all others who remain unrectified as a result of Bill 124 being declared unconstitutional, every one of those workers deserves the same kind of compensation in result of that bill being declared unconstitutional. Thanks.